Hello, everybody. Good evening. Welcome to Home Park Medical Services. Today, we are going to be discussing the signs and symptoms of breast cancer. Now, as you are all aware, October is the month for breast cancer awareness, and I believe by now you've all heard a thing or two about breast cancer. Today, we are going to particularly discuss some of the signs and symptoms, or some of the things you see when you are checking yourself or when you are checking someone for breast cancer. Now, let's begin with this. The very first thing that you notice when checking yourself for breast cancer or signs and symptoms of breast cancer are there's going to be a change in the shape of the breast. So you notice that at first the breast was a certain way, maybe it was rounder at first, but then all of a sudden you begin to notice that there is some change in shape, either between the two breasts when you compare them, or one particular breast has actually drastically changed in shape. Sometimes the change is so subtle that you might not really notice. So we encourage people to do the checks very frequently, preferably every once in a month if you so please. And we advise or we recommend that ladies who are within their menstrual cycle or their menstrual phase or their menstrual ages do it 7 days after their menstrual period. And for those who are menopausal, they should take a particular day and then do the checks on themselves from time to time, preferably every month. So that is the very first thing you notice when somebody has begun to notice changes in their breast. Now, the very second thing that you notice is the size. Aside the shape, we have the size. Now, naturally speaking, most women, or 90.99% of women, would have one breast being slightly bigger than the other. That is very normal, and in most cases it doesn't pose a challenge and doesn't pose a threat at all. But then you realize that in some cases all of a sudden you begin to notice certain changes that are too drastic, or certain changes that are too huge all of a sudden. So let's say the previous month you checked yourself, there wasn't any much significant difference between the two breasts. Then all of a sudden you notice that maybe the left breast is becoming bigger and bigger than the right one. So when you see such a thing, you need to take measures and then move very swiftly to a hospital so that you are checked as soon as possible. The very next thing we'll discuss is the nipple inversion. Now, when we talk about nipple inversion, some people have very pointed nipples that stick out. Some people have flatter nipples. Now, when somebody begins to experience the changes that comes with breast cancer, you realize that for someone with a pointed nipple, all of a sudden the nipple begins to regress or go inside and then begins to point more inwards than outward. And then for someone with a flatter nipple, you notice also certain similar changes around your nipple. So that is the next thing that you need to look out for. Then another thing that we'll have to discuss is skin dimpling. That's you get some indentations or dots on the skin, such that you realize that it wasn't there before as compared to the previous months that you used to check yourself. Now, all these things I'm mentioning, you cannot notice them particularly if you don't do it very frequently. So like I mentioned earlier, you need to check yourself every month from time to time so that when there is any sudden change or even subtle change, you'll be able to pick it up. The very next thing that we'll be discussing today is the bloody nipple discharge. So sometimes when these things begin to occur, you realize that the lady begins to have some discharge from the breast, that's from the nipple of the breast. Now, most ladies are not supposed to have discharge from the nipple of the breast, unless of course you are pregnant and your body is preparing itself for the baby to come, or you are breastfeeding. That is when we expect to have some discharge from the nipple, which in most cases is breast milk. Now, the very first breast milk that comes when a woman delivers, it's usually more yellowish or creamy like as compared to the whitish one that we are all used to. So with that one, it doesn't pose a threat, it doesn't pose a challenge. But if you are not pregnant, if you are not breastfeeding, and then all of a sudden you begin to notice that there is a discharge from your nipple, sometimes it's yellowish, sometimes it's greenish, sometimes it is bloody, like real blood stained discharge, then you need to be alarmed and then take the necessary measures and get to the hospital. Now, you notice I use the word alarmed. Why do I use the word alarmed? Research has recently shown that most women, about 4,000 women every year, are diagnosed of breast cancer. And out of that 4,000, about half of them are detected late. That means they get to the hospital late. And when that happens, the cancer is detected in the very late stages, whereby very little to nothing can be done. And in such a situation, it becomes a bit difficult for the woman herself and then for the family of such individual. Now, I mentioned the woman herself because that is not to say that breast cancer doesn't affect men, but in most cases, women are more prone to having breast cancer as compared to men. Even though men do get breast cancer, most of the time it affects women all the more. That is why you hear a lot of noise about breast cancer during October, and then the color pink has been chosen to represent Breast Cancer Awareness Month, which is the pink ribbon, as you all might have seen. So these are some of the things that you need to be on the lookout for when checking yourself for certain symptoms of breast cancer. Now, the next thing we'll realize is that there will be swelling or a lump in the armpit. Now, note that today, hear it from me, the breast does not just entail the structure you see on an individual's chest, but the breast actually has a tail, and the tail extends all the way to the armpit of the individual. And around where that tail is, there are certain things we call lymph nodes. Okay, so those lymph nodes, when there is any infection in the blood or any infection around that part of the body, they try to fight it off and then absorb those kind of infections or those organisms and then destroy them. So in such a situation, they will tend to get bigger and then get swollen. So if you are a lady, if you are a woman, and you check yourself from time to time, and all of a sudden you've noticed that there is some swelling around the armpit area, you need to check it out and then get to the hospital as soon as possible. Then the very last thing we'll discuss, which is actually quite very common and you cannot miss it, is something we call the peau d'orange symptom or the peau d'orange sign, which is basically the breast itself beginning to look like an orange peel. I believe you've all seen oranges before, as it has some small dot indentations on it. Now, when you look at the breast in somebody who has had breast cancer or somebody who has a swollen breast generally, it might not necessarily be cancerous,